You may have heard of something called a Dutch test, and I want to talk to you about why that probably isn't, in this circumstance, the best test for you. And of course, as always, featuring Jupiter and Sybil, who will be in the background the entire time. So Dutch tests are dried urine tests. They do look at hormone levels, but it's just a snapshot, right? Like it's just that day. You can do multi-day tests, but it's usually like up to 3 days. What they're really looking at is metabolism. How can you metabolize these hormones? But if you're really looking to figure out, am I ovulating? Can I get pregnant? How come my cycle is coming twice a month or once every 3 months? That's not really the test for you. Something that we do in the clinic that is so highly successful in tracking a female cycle so that we know how to best support them. And this is, of course, assuming that we have done all of the things already, that we've looked at diet, that we've looked at inflammation, that we've looked at other dis-ease in the system, and we've really addressed those things from a root cause. Especially, of course, cannot forget the gut. So we've mapped out the gut. Then we're going to want to map out your hormones. And the way that we do that is kind of unique. I'm not really aware of other clinics that do this. And it's a little bit tedious for the patient, but ultimately, if we're talking fertility, right, most of the time you're kind of willing to do whatever it is that you can to make sure that you're going to have a happy, healthy baby when you want to. So the way that we do this is we actually take weekly samples of your hormones, blood samples of your hormones on the same day every week for about 5 weeks, depending on whether you have an extended cycle. Obviously, we would want to track it a little bit longer if your period is coming every 8 weeks, for example. After that, we have the data that we need to evaluate and map and find out, where did we go wrong? Why didn't you ovulate? Did you get an LH surge? Are we having appropriate levels of estrogen? Is your uterine lining even thickening enough to have a period? There are so many things that those hormone surges or lack thereof can tell us. And the only way we know what's happening week to week is if we look at those hormones. So I don't want you to think that I don't like the Dutch tests. I don't use them often in my office because honestly, we look at a lot of those metabolism pathways and methylation status in different ways, in ways that I believe are honestly just less expensive. So we can interpret a lot just with basic blood work. We can certainly interpret a lot about metabolism by looking at your stool, believe it or not. So I don't use Dutch tests in my office. Not that that's not a great product for you, but it really does kind of depend on what your needs are and what you're looking for.